Hi and welcome to episode one of Scrubs and Short. You guys know me by my Instagram handle Visited India. I'm Dr. Manish Taneja. I'm a critical care fellow here in India, a doctorate trainee. So let's dive into it. We have two guests today. We'll be discussing about residency in different countries, Australia and US. So let me introduce you to the guest. It's Dr. Komal. Hi.
Hi, how are you?
And Dr. Weber Wig. Hello.
Hi, how are you?
So, guys, tell me a little bit about yourself. Tell all of us a little bit about yourself.
Wherever you go first.
Okay, cool. I'll start. So, I've been working as a resident in Australia in one of the regional hospitals as in emergency since last 1.5 years. I'm actually graduated from India. I've done my MBBS from Amritsar. And my journey has been quite ups and lows because of COVID, as you must know. Did my exams back in 2019 and then got stuck there. Did my master's in public health over there and then moved back, came back again. So it's like a bit of ups and downs, but now currently working in emergency and will be planning to get into the training program in a year or so.
Nice. Good luck, Weber.
Thanks for
You
that.
go next, Dr. Komal.
Hi, I'm doing my residency in US. I also went through a lot of ups and downs during COVID, but I came to the US amidst the pandemic where they used to do the quarantine thing in another country
Yeah.
for 15 days. But I had no money, so I did it in Egypt. I didn't like do it in one of those expensive countries. Um, and then I came here, did some clinical rotations. I found a research fellowship at Mayo Clinic, did that for a year. I was unpaid for half of it, and then they started paying me. So finally, I had money to apply for residency, and I matched in UAMS at Arkansas Little Rock. And I'm a first year
Nice.
family. Well, I'm a second year family medicine resident, not first year.
Congratulations on the promotion.
Thank
That's how
you.
time flies, I think.
Yeah.
I was like, I'm a first
So,
year resident. Oh, no.
yeah, even I didn't realize when turned second year, and now I'll be in third year very soon. So, yeah, but I'm doing my fellowship, so it's
Fellowship.
pretty chilled compared to the residency. Residencies are toxic. So, yeah, let's move on. So, why did you guys choose to move to a different country to pursue your residency or to work there? Compared to in India. I think you can go first, Weber.
Sure. So I think moving to another country is a big decision, like everyone has to make. And I think it's dependent on not one reason, but a multitude of reasons. I had my reasons, and few of them was like, I did work in one of the corporate hospitals in India in Fortis, and I found the culture to be a bit toxic and the working hours too bad. I mean, was not my cup of tea, and the way the system was working, it feels like you were just a cog in there. You're not upskilling yourself all. You must be knowing the same thing, like you're working in corporate. Also, and then the amount of money or salary you get over there is not enough. The only good thing back home is that you've got your parents, you've got enough support um, for you to keep going. But otherwise, I think, and then the plan of moving to countries, it totally depends not only where you want to practice, but actually where you want to live. Because I think a residency or working is a part of your life, not the whole life. So you have to make the decision which country you actually want to live. I've been here a few times, so I liked it. So that's why the move.
Yeah, nice. In India, it is our systems are designed. I don't know if it's due to the population issue or whatever it is. Our systems are designed in such a way that we are trained to climb up the ladder as soon as possible. Do your MBBS, get into your PG, finish your PG, do your DM or doctorate or whatever it is, and then
Yep.
become a consultant and make money. And then you have to thrive to become a good a famous physician who sort of has a
Mm.
very good private
Hmm.
practice. Otherwise, you feel lost, and you feel sort of like a loser or something like that. You cannot just be content with what you have. In India, systems are not designed for this. I mean, you are a medical graduate and it should be enough, but no, it's not, at least in this country. So, and you get paid like that only. I mean, at least in private. In government setups, you have a decent pay for MBBS doctors.
Mm.
Yeah.
Yeah,
So
that's
yeah,
true.
Komal, you can go
Um,
next.
I never wanted to practice in India. I knew that from when I started MBBS. So I started with knowing that I have to go to the US for residency. I knew it maybe even in high school or something. But it was all just because I had family here. I knew the lifestyle, I knew the pay, I knew the work hours. And then as I became, like I got into MBBS, I started realizing more the differences because from far away it looks all nice, shiny, and polished, but there's like a lot of caveat to all of this. Um, I just knew I had to come because of exactly everything you said. The work culture in India is really heavy. It is rewarding in other ways, but it's not as rewarding monetarily. So that was one of the factors. Also, subjective again, but quality of life differences. And the training here, I like the structured training here better than India because they try to hit all the milestones in all aspects and not just like, oh, number of this, that, this, that. It's like
Yeah, that
they train you for life more rather than a machine.
That's good to know. Yeah, Indian training is more about just it's a factory. You want to produce more specialists and more doctors and more trained physicians. I mean, you don't care about skills as much, although you sort of end up getting those skills because the sheer number of patients you end up seeing in
Hmm.
this country is just beyond anywhere else in the world. I believe
Yeah,
the
That's
the
true.
the population of Australia and US is probably similar to Uttar
yeah,
Pradesh's population, if I'm not mistaken. So the
No, no,
sheer
no.
number of patients
It's. I think it's
less.
equal to just Delhi or
Yeah, yeah. I
Punjab
mean,
if you can
it's
compare.
Australia is pretty less. I think US is around 300 million, which is close
yeah,
to Uttar Pradesh. So yeah, it's the sheer number of patients you get to see in your residencies, even in a big corporate hospital. In government, it's insane. In big corporate hospital, it's as good as
yeah.
anywhere else in the world. So yeah, the you acquire those skills, and that is why Indian doctors are sort of
Very well
rewarded as well.
respected.
Yeah,
Yeah,
well respected as well. So yeah, so Indian healthcare system might have its flaws, but it's not that bad. Also, it has its upsides also.
it
So yeah,
does.
why EM Webhub? Why emergency medicine?
Well, I think like Komal,
I'm a trained emergency physician, so you know I get it. I might those are your answers might resonate with me. So, but still,
I
for the
mean,
people,
initially during my MBBS years or even my internship, I was like completely clueless as most of med students are. Like they don't know what they're gonna do. They look up to their seniors or what they are doing. And I think when I started working in one of the corporate hospitals in India, so I did a mix of crit care plus ED. I was liking the way ED works, that you don't have any continuity of care with anyone. You just treat and get like it's very rewarding. Immediately you get people fixed quickly. But the problem with the Indian setup is there's no robust system which can like a pre-hospital notification, or you can see that the people are coming in. They just come in gasping and
yeah,
you have to quickly
pre
do something
hospital care
about
is
it.
non-existent.
Non-existent. And even the paramedic care, like here when I came here, I mean, that was the thing that I knew, that Australia's got that system. Even Australia, UK, and US, all the developed countries have got the proper pre-hospitalized system, and they have got their system in places not even in tier 1 cities, but also if you go to regional areas. Like I'm in tier 3 town, and still they have got, like, the system is so robust. I mean, you can't even compare. And when I came here, I worked here. I mean, the environment is so good, the way you practice, and the workload can be heavy at times, but still you learn a lot.
Nice.
So it's, I
So
mean,
in
the interest for EM, I think, developed over time, and I think it's gonna grow more.
Nice. In India, even in tier one cities, we have the EMS system, the pre-hospital system, which we have is basically scoop and run.
Mm.
You people will
Yeah.
scoop, and there are. I mean, recently I have started putting gloves and ambu bag in my car because I've met a couple of accidents, and where I ended up calling ambulance on the street, and they did not have things at their
Mm.
hand. So yeah, I was like, okay, I'll start keeping it. It's not very, it's cheap only. So yeah. So Komal, why family medicine?
Yeah, so exactly opposite of what Vaibhav said, like continuity of care. I like it.
Hmm.
I like
Hmm.
knowing what happens to a patient from start to finish. But also, like, I don't know if many people know what family medicine is, because in India, it's quite a recent
Yeah,
specialty. It hasn't been around for long. But
and
in
it's not
US,
very successful in India because of various reasons. Yeah.
yeah, that's what
Hmm.
I don't get it at sometimes, but here it's a pretty big thing. It's like the backbone of the country, like primary care. That's the backbone of any country, and you need to invest in it. So for me, I started liking family medicine when I realized that I get to do inpatient, I get to do outpatient, I get to do OBGYN, I get to do pediatrics, everything in a single specialty. So I could probably, if I wanted, I could go into a completely outpatient practice at some point in my career. If I want inpatient, I can right away after residency just go be a hospitalist somewhere. Or if needed, I could also do on and off mom and baby service. Like you
Mhm.
deliver the baby and you take care of them in the nursery. So there are like so many different options, and then there are different specialities afterwards that you could do. And so I liked knowing that there are so many options I could work in, and also knowing that it's somewhat rewarding that you're making a long-term difference in someone's life.
Mm.
Yeah. So in India, it doesn't work because the
You
access
directly
to
get the specialists.
Oh
the
yeah.
access to specialists is very easy and very cheap compared to in US or in UK or somewhere. You'll have long waits to see a specialist, but in India you can just dial in and go today and get yourself checked by a
Yep.
specialist.
Yeah,
So
I think, but that's one of the good things of Indian healthcare, that you don't
yeah,
have to wait around for specialists, don't wait around to get imaging. In the
yeah,
ED, you're pretty well catered. So,
it has its pros and cons. People don't understand waiting times at times. I I mean, when I was working in AIMS as a JR in the ER, that is where my fire for emergency medicine started. So when I was working in the AIMS ER, there were long lines outside on, people were lying on the gurneys on the stretchers, and they were waiting for their number and all that for hours together. And when I joined my residency, it was one of the biggest corporate hospital in Delhi, so Apollo Delhi. People didn't want to wait. They didn't understand the concept of waiting. And during COVID, a lot of things changed, and we had to introduce wait times and all those things. So people were really disappointed. So people in India, they want instant, access to their doctors. They don't want to wait. They
oh
don't
my
like to
gosh.
wait. So yeah,
I mean,
that is one
that's
of
the
the things.
reason most of the NRIs, they'll just make a trip out of India and get the surgeries done, get the
Yeah, yeah.
medications and everything, scans done.
My one of my friends' family is in the US. So I think his mom got appendicitis or something, and
Yeah, it's better to fly
she
out.
came. Yeah, she flight to India to get the surgery done, and she was like, "I, for the money of a CT, I'm getting everything covered here, like including the flight."
100%.
Yeah, yeah.
100%.
So
Like a dental procedure here could possibly cost you like thousands of dollars, like a root canal.
yeah.
इंडिया
Yeah.
में कितने में होता है रूट कैनाल?
15,000, 10-15,000 in a
बस
very good place.
नहीं, ये तो गुड प्लेस में है, मैंने तो 2-3 हज़ार में किया था.
So yeah, uh,
Oh, I mean,
yeah,
in US, the actual cost of procedures are, I think, very inflated because of
yeah,
the
very
private
inflated.
health, right?
Yeah.
It's all, yeah,
Because
your insurance dictates your price, so
Mm.
yeah, all everywhere there are pros and cons. I mean, India has its pros and its cons as well. So yeah, so you guys have moved to another country and started your journeys. Uh, from you were trained from India. So did you guys ever have any cultural shock experiences? Some experiences like that. I would like to know about it. Komal, I think you can go first this time.
yes and no, because on some level, because of the upbringing or friend circle, you're a little bit exposed to the Western culture through shows and TVs and stuff.
Yeah.
So it wasn't like, oh wow, they're doing that. No. But when I started working in healthcare here, that was a big learning curve because um, one thing we don't learn in India is professionalism in like a work setting
Hmm.
to ultra pro max level. So here you cannot say a word wrong. You cannot assume that oh the samne ka person understands what you're saying. A workplace is a workplace and you have to put on that face and that gentleness, that honesty, which I do think is needed, that you always have to be professional 24/7. It's almost inhuman at a point that you're not allowed to show your emotions as a doctor, but that's just how it is. Like it could end up pretty badly if you say something wrong sometimes. That was a big culture shock that in India we just say things and move on because there's no repercussions
We
of
joke
that.
around with our patients. Some of
Yeah.
those jokes are not kind.
Yeah, they're not kind. And here
Yeah.
you could like, yeah. So that is one thing. And the other thing is documentation here in healthcare is US is all about cover your, like you just have to cover all your bases in your notes. So whether you gave that patient nitro or not, it doesn't matter. Did you put it in your note? It
Seriously, I thought that was
should
only
be
in this
there.
country or something.
नोट में
Okay.
होना चाहिए. If it's not documented, it's not done. That's how it is. Put
I worked
everything
in
in
three,
your
four
note.
JCI, accredited hospitals, Joint Commission
Oh, really?
accredited
Yep.
hospitals. So yeah, my training was my DNB is from a Joint Commission hospital. I was a attending consultant in Vedanta, which is a Commission hospital, and Fortis Escorts earlier was a Joint Commission hospital. I've worked in Max Hackett. I've worked in Max Hackett, so that's also a Joint Commission hospital. So yeah, I know how documentation and all those things are there. How much they stress on documentation, on noting down everything. But I didn't. I mean, we were not like that. Like whatever we did, we just jotted those things down. I mean, I didn't think that it would be like that in the US, where you would.
So
Uh,
let
yeah,
me give you an example. If you go
yeah,
and talk to the patient at midnight who has started acting up, like he's delirious and somehow needs Zyprexa or something, you have to put it in a note. You have to
okay.
say that you went and saw the patient, assessed him, examined
Yeah,
him, and then did
that's
that.
true.
Yeah, I mean,
That's just,
we did that, huh? Yeah, we did that.
you did,
We
yeah.
sort of, yeah, we put. I still do in the ICU, even though I don't work in a JCI hospital anymore. But I still do whenever. So those habits, the I used to write in capital letters, so I still write in the capital letters and all those things. Those habits are there now. It's been a while, so
Yeah,
yeah. Some of those things are good. I think
it
since
is.
my wife is a lawyer, so I
Mm.
know the importance of covering your tracks and covering your backside and everything.
Backs,
So yeah,
yeah.
yeah,
It's good
yeah,
work ethic.
yeah.
Right.
So yeah, good. But so nothing, no cultural shock or anything in the
This
practice.
was the cultural
Yeah.
shock that
Okay.
you just have the professional aspect of it, and well, the patient population also is pretty different, so that's also
Yeah.
shocking sometimes. But
And they might be like they might have more expectations and all that. In India though, like people just want you to
Oh,
बस बता दो
yes.
क्या है क्या नहीं है. Yeah.
Yes. Oh my God. You have no idea how many times after a long day you see your patient's family wanting to see you like at 7 p.m. after your shift that started at 6, and you have to go and explain to them for 20 minutes what you explained to them the day before. And then the next day they'll say, "Hey, no one talked to us, man.
Mm.
Who was that person who spoke to you, my ghost?" Okay.
That happens here. In corporates, it happens all the time.
Gosh.
Yeah. So Vaibhav, what about you? Did you have any cultural shock experiences, except like eating kangaroos? Maybe that was a cultural shock. Yeah.
No, actually, I knew it before moving here.
Yeah.
But as such, it wasn't a cultural shock because I didn't just move here and instantly started working. I've been there
Hmm.
once in 2017 and then I moved in 2019. So I've stayed here for a few years. Um, but as Komal and you said, documentations and patients' expectations, like patients have been investigated for a problem for a year, and then they come to
Hmm.
emergency and they say, "Oh, I want to know answers to that." It's like
Yeah.
that's how can you
At two in
expect
the
that?
night. Uh,
That too in the night.
uh,
And I mean, I would say 99% of the patients here or people here are quite understanding of the work which emergency doctors do, and they quite recognize that these are also doctors. Contrary to back home in India, they think, oh, gastro is a doctor or a surgeon
hmm.
is a doctor. They must be someone else. But who is emergency doctor? Here they do recognize it and they do value the work that you do, and they understand they have to wait. They, contrary to I think back home, they can get angry over a little bit of things, and you know the things that can go wrong even if you're in a government setup. But I would say 99% of people are understanding. Also, the biggest cultural shock here was, I mean, the astounding number of mental health patients that we see here.
Yeah. Yeah.
I mean, it's still, I think in India it's very untapped kind of thing. It's still a social stigmata. People don't go and get it checked, and but here it's, I mean, the numbers are way high.
Yeah, that's so true.
And
I
also, it's
think
because of the way the fabric of the society here is. It's quite different to back home. People
Yeah.
have joint families and they have friends and all that. And here, people, I think more. I won't say most,
isolated.
but some people they are isolated, and that actually adds on to their worsening mental health and childhood traumas.
So yeah, I mean, about emergency physicians in India, it's getting better now. People are recognizing emergency physicians. People are many doctors are choosing emergency medicine. One example is in front of you in India, and we are enjoying emergency medicine, and people are accepting our role and understanding our role and sort of becoming more. Emergency medicine is becoming a more accepted branch in India now,
Mm,
which is a good thing. Also, I think it is my theory. I don't know. I mean, if I'm true or if I'm right or wrong, but I believe that once you have your bases covered, right, your basic needs like roti, kapda, makan, those basic needs. Once you have those things covered, then only you can think about the existentialism of the life. So
mm,
in a country which is still trying to sort of go reach to a certain level of GDP and per capita
mm,
income, people are still sort of suffering, and are struggling with their basic needs, and they don't have a lot of accessibility or the time to sort of go into that existentialism, and that's why we don't see mental health issues here more often, although we might be
mm,
having. We don't see those things more commonly here in India. I Yeah, and that is why probably you, and obviously what you said was right, that the fabric of the society is knitted in such a way in India that we have more moral support and all that
yep.
back at home, which
Yeah.
people might not. Yeah. So, यहाँ तो if we at 25, if we decide to live away from the family, they'll be like, क्या बोल रहा है? And there, तो it's very common, right? To to have a job, live on your own, and all that. So yeah.
Yeah,
the
that was
society.
a good point though, that
Yeah.
Hmm.
mental health illness is a big thing. I don't know how much of it, like you say in India, it's a good thought that it could be existentialism.
Hmm.
When you're sorted and settled, you have time to think about the other things. But I also feel sometimes it's just undiagnosed. Like
Hmm.
Yeah,
these people
probably.
are also allowed to have those things, but they just never think that it's something they can talk about or something that's wrong. It's just that is also a
Probably.
fabric of the
And
society
stigma,
that,
the stigma as
yeah,
well.
Stigma.
Yeah, that's right. So, I know, residency in general sucks. Uh, I wasn't a big fan of mine. I still am not a big fan of what I'm doing. I'm sort of a resident only. So, I am a resident, senior resident. So, residency in general sucks. How is it with you guys there? Think you can go home. How are your timings? Your
yeah.
duties? Is it busy, hectic?
Yeah, so generally, first year tends to be harder for everyone. In family medicine, what we do is we rotate in so many places. It's a chaos unleashed. Like you're a baby intern coming from a foreign country, and you're just thrown into this madness. Like what we have is a block structure, so we do monthly rotations. So 1 month, suppose we have a schedule prefix that these are the 12 rotations and 12 experiences you have to get throughout the year. We have different rotations like inpatient, which is wards. We do 2 months of that. We do inpatient at the VA, and VA means Veterans Affairs, where all the US veterans have specialized care. They have their own EMR system. So we have to learn that. It's called CPRS. So it's not a secure epic that we use. So that it's not just the medicine part of it. In fact, sometimes it's easy because it stays the same across campuses, across EMR, but learning the EMR sometimes is challenging. Like you have to learn this and then that and then learn the workflow, the nurses, the calls, the numbers, the pagers, all of those things. So here they do a pager system, so we get little pagers, the old school ones where they send the numbers all and then you call them, you run to a code. Like even codes are paged. So you can leave your
That's stupid.
phone probably, throw it away, but your pager has to be on your chest.
Hmm.
So suppose like so that's something we do inpatient, and we do outpatient, which is generally 8 to 5. We see up to in first year, we could see anywhere up to 12, 14 patients, I think. I don't remember, right? Which are divided in 2 half days. We have academic half day in the, like lunch break in the middle, which is 12:40 to 12:15 to 1, where they give us food, which is a great thing. They give us free food 3 times a week. And
Nice.
Hmm.
inpatient starts pretty early. It starts at 6 in the morning, so you have to be up at 5. But and it ends at 6 when the night person comes on. So night person stays from 6 to 6. Who's the call person? And then we also rotate in L&D, which is labor and delivery, and everyone knows how that place is. If you think Indian L&D OB department, and that is ugh, this is also the same. So one thing that stays across borders is how L&D works and the whole vibe in the OBGY department. So we do that for a month. We do nursery where we take care of really tiny babies, like 28 weekers, 24 weekers, try to keep them alive. Or sometimes we do like inpatient pediatrics, which is grown up babies, but just pediatric pathologies and radiology, urology, cardiology. So we rotate through
Nice.
all of these in first year.
Across the board.
The
Hmm.
outpatient typically would be 8 to 5 and inpatient is 6 to 6.
And how many times a week you have inpatient
So you do a month
of
of
inpatient?
inpatient, a month of outpatient. So in outpatient, generally you get weekends off, which is great. But with our system here on the off weekends, 1 or 2 weekends, you're on call in the hospital. So for 24 hours, you cover a Saturday when the day team gets off or it's their off day. So it's not really that much time that you get off. And while you're inpatient, you just get 1 day per week. That's all. So you get 4 days off a month. And
which
yeah, so
is the
it's
norm
pretty
in
hectic.
India as well.
Yeah.
Yeah. So what about you, ever?
Ah, well, compared to India and US, Aussies love their time off. They want their work-life balance.
Nice.
So we are the chillest kind of people around. I'm not into a training program, but I know my fellow trainees who are going on to a program or in their program. Hours are totally the same. So I work a maximum of 80 hours in a fortnight. 10
In a
hours
fortnight.
usual A usual shift is a 10-hour shift. Either it's going to be a morning shift or an afternoon shift or a night shift. So 10 hours each, 8 days a fortnight. So I work 16 days a month.
Okay,
And
nice.
if we work more than 80 hours a fortnight, everything gets paid overtime, which is double.
Nice.
So ED working hours are like quite, so we get a lot of time off. I can go around, do my things and everything. And that remains the same even if you're doing a residency here. Residency in emergency is a total of 5 years as compared to 3 in India or in the US. The reason being the population is not too much, and also they want the physicians to be trained for a longer period of time so they can churn out a balanced number of consultants around. Um, yeah, so and it starts basically if I want to apply to the college. So essentially, once you get an unrestricted registration here, you can apply to the college, specialty college in emergency medicine here, which have their own criteria. This apply to the college. Once you get accepted, you need to sit your primaries, which is just the equivalent of MRChem in the UK or MRCP. So you sit a couple of exams in your first year, and then you become an advanced trainee. You go through year two, three, and four. And essentially, in your year four or your last or second last year, you can sit your fellowship exams. Two more exams. One is written, and then one is OSCE. You clear that, and then you are granted with a degree called FACEM, which is Fellowship
Yeah.
of Australian College of Emergency Medicine. Then you get to wear the prestigious black scrubs. It's like a restricted item in Australia. You can't wear, only the
Nice.
patients can wear it.
I wear black scrubs.
Me too.
Yeah. So I like the color, and it shows less blood. So yeah,
Yeah, that's exactly what.
yeah,
Stain free.
yeah.
Stain free.
So 40 hours basically a week. That is what
For
you work, right?
yeah,
40 hours a week.
it's not technically 40 hours a week. It's 80 a fortnight. You can even work like those 80 hours in seven or not seven,
8 days.
9 days, and then have 5 days off.
Okay, nice. Uh,
We have like an 80-hour cap that they say in residency you can't get over 80 hours per week, but we go up to 60, 70 pretty regularly.
60 hours a week.
60, 70 hours a
We
week is.
we have in India we have a cap of 48 hours a week, but I mean it rarely happens.
Oh, really? I didn't
Yeah,
know that.
the labor laws, basically the labor laws are the same right across the board. So labor laws state that 48 hours a week
No,
is
but do they follow that at all?
no. I mean
I
most
never thought.
places
No,
most
I've
places do
actually
not.
I've actually worked 48 hours in Fortis in my hometown.
In
Um,
corporate hospitals, if you are
it's
especially if you're a salaried employee, you'll probably end up working close to 48
No,
hours.
I'm talking about residency. Like in
Residency,
residency, I
it's
don't
no,
have
a
anything like that.
residency.
no.
They don't have any hours because actual meaning of resident is
You have to
you stay in
live
the
Yeah,
there.
hospital.
yeah,
Yeah.
yeah,
I think
yeah.
I
That is
do.
there.
Yesterday, I had friends over and they saw that my house was a mess and they was like, "Do you even live here?" I was like, "Not really."
Yeah. So yeah, that is there. So nice. Let's move on to the next segment, the most interesting one, which everybody wants to know about, the money talks. So I'll start with India. I mean, as a resident, uh, back when I was doing my residency, it's been a few years. So, but I'll give the equivalent numbers. Uh, right now, the residents in my hospital or like standard uh, New Delhi government hospital salaries around 12 to 13 lakhs per annum. Uh, how about in your countries? I think you can go first, Vaibhav, this time.
So I'll start off with an RMO salary, which is a resident salary, and then once you actually get into a training program, you're not technically a resident, you become a registrar. So you get more salary. Currently, I'm in my year two resident. I earn technically after taxes 7 to 8 thousand Australian dollars a month. And if you take a gross salary, that will be equivalent to 1,20,000 dollars before tax a year.
And how
For
is the conversion and
for
everything?
So, I mean, if you convert monthly basis after tax, I think 7 to 8 will equate to 3.5 to 4 lakhs a month in Indian salary for me. But if I'll be in a training program, I'll be a registrar that can easily go to 5 lakhs, 5.5 to 6 lakhs a month after taxes. And then so almost you can hit almost um, 50 to 60 lakhs a year as a trainee if you can.
And how's the
But
living cost?
I think the conversion is
Yeah,
not right.
flawed. Yeah.
The cost of living in Australia is like sky high, but
Yeah, you go
still,
by the
yeah,
PPP.
yeah, the purchasing
Purchasing
power
power
parity,
parity.
I know it's right, but still there's something you can't compare, like the quality of life, the air you breathe
Yeah,
in, the place where you live. But yeah, it's expensive, but it's rewarding, and I think it's fairly compensated.
that's pretty good actually because here, um, as residents, you just get paid minimum wage, maybe less than that for the amount of work you do. So I think US minimum wage generally is 14 hours or $14 an hour or something, or I don't even know. But
Depends on the
me,
state, but yeah.
yeah, so I am one of the lower salaried states because Arkansas has a very low cost of living and it's one of the most worst healthcare outcome state. They have very poor healthcare literacy, lots of comorbidity. So in general, the state is pretty unhealthy. I get about 3,800 or 3,900 per month. This is after tax, and then like up to whatever 50K per year. Um, that's resident salary. It stays the same for 3 years. If you do fellowship also, you're still paid a fellowship salary, which may be like 60, 70,000, not much more than a resident. But as an attending, it just like skyrockets. It goes up to $300,000 a year. That's
Hmm.
outpatient for family medicine. And then on top this, but this is post tax. So it'll come
Pre-tax.
deduce, yeah, pre tax. And then you also have your RVUs, your bonuses, which here they incentivize good practice by having RVUs. So as long as you meet those needs, you get like certain number of points which are paid for and covered for. So it adds up. So
So,
that's just FM, but other specialities, every state, every work practice, and locums, considering everything, it can range. It's always a range. That's what I try to tell
yeah.
everyone.
Yep.
Don't think of it as a one fixed number, it's what you make out of it. So remember, whatever
Same,
you
same.
read
What I told you.
online, yeah,
What I
whatever
told you
you
about.
read online is not, it's just a
Yeah.
number. It's not
Hmm.
the gold standard. So don't
Yep.
go chasing those numbers.
Yeah, yeah. I mean, after residency, though, you get paid pretty decently, handsomely in US. And one of the best countries to make money as a doctor, I think, is
Definitely.
US. So yeah, and what I was telling about India is the highest, right? I mean, in the Delhi is equivalent to the central government. So yeah,
Yeah.
you get paid the highest here, but in many other states, you don't get paid as much as a resident. But you can obviously, after you're done with your residency, you can make a lot more money depending
Yeah.
upon your practice and your salaries and whatnot. So how is the cost of living there, Vaibhav? Can you save as a resident? Can you send something back home if you even want to do that or something like that?
Hmm.
Can you plan for your
So,
future, for retirement and all that?
yep. So, yeah, cost of living is high. I
Hmm.
mean, it's a good thing I'm not currently living in a tier one city, otherwise, I would have nothing
Yeah.
to say. But the other day I was just kind of budgeting my whole thing and having a look at the numbers because I've been doing it for like almost a year now. So I feel if I get 7,000 in my bank after tax, and if I deduct my rent, if I get all these groceries and stuffs and bills and everything and insurance, I think I can pretty much save 30 to 40% easily.
Nice.
And even I think 10 to 20% I can send into my mutual funds. I can put stocks and everything on, and still I'm able to save a fair amount of money. People can send it back home. My parents fortunately don't need a penny from me. They're like, you enjoy, you do your own thing.
Nice.
So, I mean, it's if you plan accordingly, if you don't try to live a lavish life, which most of the, I think residents make a mistake initially when I came here. When I got my contracts, like, oh, I'm gonna make this much money. Maybe I'll go. I called the Toyota dealership and was like, oh, can I have this hybrid Camry? It's like, okay.
Yeah.
Fortunately, they had 12 months of waiting time for that. And I dropped that plan and I
Blessing in disguise,
decided
huh?
yeah,
Yeah.
it was. I mean, I decided to get a used car, and I think that is the best decision of my life. I got it for a few $1,000s, and it's money saved. I don't have a debt,
Yeah.
and it's a good thing.
Nice. What about you, Komal? How is the living expense
Yeah.
there? Can you say?
So I'm in Arkansas, which is pretty low cost of living. So that helps. Even though it's the state capital, it's Arkansas. It's like the southern part of US. So it's pretty cheap like that. My rent is $1,000. I also got a used car, but a relatively new used car, like 2021 model. So 500 goes to that. 500. My insurance used to be pretty high, car insurance, because I was a new driver, but I was able to get it down. So that's an added expense. Groceries and stuff, because I like to cook a lot. So that's always there. And I try to live quite frugally. So I furnished my place off of Facebook Marketplace. I try to buy everything super cheap from Amazon, Walmart. I try not to eat out, save in that way. And I invest every year in Roth IRAs, mutual funds. So
Hmm.
50%, or at least I try to max out whatever I can every year. Uh, so but then lately I've been traveling a lot, so that's a lot of credit card bill, which I paid off. But that's one thing I like here is you get a revolving credit cards. You have open accounts which you can like do all your expenses in and pay it off, and then you get a good score, and then you can build off of it. I think it's getting common in India too now, which is a
Yeah, yeah.
good thing because it
Sibyl is
just
the same.
helps. Yeah, it helps. So I would say you can live off a resident salary, but saving for some people might be difficult if not mindful. You just have to remember that everything you save now, you'll always think as an attending, I'll get so much, I'll save that time,
Yeah,
but you have to start early. That's the
yeah,
goal.
yeah. You should. I'm
I,
regretting
I
not
I
starting
think the
early.
I think the major flaw we have as a resident is we think, oh, when I'll be attending or a consultant, I'll make a point
Yeah,
0.5 million or something. But we forget that even the consultants here are struggling because
Yeah.
as you become a consultant, your house gets bigger,
expenses
you
go
get
up.
a
Yeah,
Porsche, your goalpost like kinds of shifts every time.
yeah.
One of my
That is there.
mentors told me like Dr. Bhagra, I think he told me that yeah, जैसे आगे आगे जाओगे वैसे गाड़ी बड़ी हो जाएगी, घर बड़ा हो जाएगा, खर्च बड़े हो जाएंगे, and tax ज़्यादा लगता है. So the more you make, the more you pay back. So it
Yeah.
eventually pretty much
In
stays the
India, as
same.
soon as you cross the 15 lakh bracket, the tax is crazy.
Mm.
Yeah.
So,
How much is it?
yeah, around 30% after 15 lakhs, I think. 25,
Mm.
30%. So, yeah, the taxes are getting crazier in India, but we don't get a lot in return
Yeah,
of
that's
what we pay
Yep.
for
exactly
that. So
true.
that is the problem. So
Yeah.
yeah, I mean, I so one of the reason why I have a few steps of American. I keep getting those UK calls, job offers, and all those things. I can go and work in the UK if I want to, but I don't want to. I enjoy my family time, my life in India.
Yeah.
And the
Hmm.
best thing about India is, you can, if you have the money, if you make a decent living, you can really chill. Everything else can be done by
Yes.
somebody in India,
Yep.
which you can't have
The
that sort
biggest
of
thing
life.
we
Yeah,
missed.
No,
which
nothing can. Those are things money can't buy,
yeah,
honestly. Like, I was
yeah,
telling someone yesterday that I had a driver, cook, cleaner, everything you need.
yeah.
Like, here, after you come from work, you have to like start cleaning and cooking. It's like
Hmm.
a job after another job.
Mm. I mean, I have recently become a father, so I mean, we have not yet uh, hired a nanny or somebody, but some of my friends have, and basically they don't even have to do most of their, child's childbirth things. Somebody comes and cleans and all those things. So it's
Yeah.
really crazy in India what you can get with the amount
No,
of
nothing can
with the money.
compare
Yeah,
that.
yeah,
Honestly,
yeah.
if ever I go back, that's the reason.
Yeah, so
Family
let's
and
come
that.
to the next part. Would you guys ever come back, or would you consider coming back? I doubt. I mean, with the conversation we have had, I think I have my answer, but let's, put it out there. If at all, what would make you choose it? I think
Uh,
Vaibhav can go first.
Yep.
Or you
yeah.
can go first.
I
I
mean,
think you
Um,
did said. Yeah.
I mean,
okay. Go ahead. Yeah.
the way and the time I've worked here, and I think obviously I'm gonna work for next at least minimum 15 more years in the
Hmm.
department. And I think that shift from an Indian to an Australian and then coming back to Indian would be like a major change
Hmm.
because you get used to things, you get used to setups, and you kind of get used to some kind of luxury which you can't fall back on. So, I mean, it's gonna be very difficult. I mean, 99.9% I won't. Maybe I
Hmm.
will when I retire. I've got enough money. Maybe I'll buy a small house in Dalhousie or something in the hills and
Yeah,
just stay there.
that is my retirement plan.
Me too.
Yeah.
I don't know. So far, maybe not initially, but if a good opportunity presents itself over there,
Hmm.
maybe. I don't know.
Okay.
It depends. Wherever, I'm open to options. I don't see anything like that coming or happening anytime after residency or in the next 10 years. But things change. So if a good opportunity comes up, maybe.
I have exactly met one person who came back from US residency. They
Hmm.
left it midway, which is very weird. And other than that, I've never met anybody who came and settled back to India after doing their residency in the US. I haven't met. That doesn't mean people don't exist. Those people,
Hmm.
they do exist. But I've met
Yeah.
a lot of people who came back from Australia and from the UK. So
Hmm.
Yeah. Yeah, yeah,
I
yeah.
think
That's
life is
true.
more isolating in the UK and
Yeah.
Australia.
Hmm.
In the US, I think the Indian diaspora
Exactly.
is
Exactly.
there,
That's
which
what I
yeah.
was going to say. Here you have a pretty, you feel like this starts feeling like home at some point. It
Hmm.
already does to me. This feels like home. But again, I have seen a few people who do go back, but they go back for either family and health reasons or private practice setup career type. So in India, so here you will earn a lot, but in India, if you have that backing, if you go with the funds from here and set up your own thing there, the sky's the limit.
Yeah,
Hmm.
yeah, that
I
is
mean, it
there. The
also,
conversion ratio is huge. Yeah.
Yeah.
I mean, it also totally depends on the who you're
Branch.
living with. Yeah,
Yeah.
I mean, no, the social structure, if you say, I mean, I know it's quite lonely in UK and Australia, especially the place where I live. I hardly see Indians around, but I've started to see people because of the government policies. They're pushing more people into the regional areas. And the good thing is, I've got my younger brother here. He's in my working in my
Oh.
department. He's just moved this year. So that's a good thing.
Nice.
He lives with me, and my mom dad have been here two times. Like in the last year, they've been stayed here for 6 months. They're retired, so they can come anytime. So
Oh, that's so nice.
yeah.
Nice.
So it doesn't feel like, oh, I'm getting a FOMO, I need to go back to India. Although anytime I want to, I can book the flight and I can go anywhere.
Nice.
So it's the part that you can go anywhere, you can see anyone is satisfying.
Yeah, yeah,
That is more important, right? You need to feel
Hmm.
connected, otherwise, the
yeah,
isolation is what makes you
yeah.
break down.
Yeah.
Okay, so guys, thanks for joining, and let's end it here. Uh, I wish you guys all the best for your future and for your channel, for your content creation
I
journey.
do have one more question if you have two
Yeah,
minutes.
yeah, yeah, sure, go ahead.
What made you all start social media?
Uh, to be frank, I was getting bored in the new residency and I wanted some excitement. I like teaching, so I was like, why not? Let's do it. I have tried my hand on online teaching earlier. I started a podcast long back. I did couple of before I got married. I did couple of episodes, and then I got busy and everything, and didn't work out. So I
So for you,
did
it
try.
was teaching. You
Yeah,
like to teach.
I wanted to engage myself into something where I felt I was sort of mm, uh, getting something out of it, because the residency gets monotonous, gets boring, and critical care, it's not like emergency medicine. Critical care, the problem with critical care is you have to wait a lot. You wait for sometimes days for the patient to come out of the sepsis, sometimes days for their encephalopathy to get better, and it gets a little monotonous, it gets a little boring. You're just sitting there. In emergency medicine it's different. Patients are wheeling in from the front door, and there's excitement, and you go back home, you're tired because all that. So yeah, I mean, I wanted to sort of get engaged into engage myself more into teaching. So I thought, since we have internet, why not?
Yeah,
Hmm.
Thankfully it's working.
yeah.
Yeah,
I enjoy watching your videos and learning from it.
thanks,
Like
thanks,
Yeah,
sometimes if I
seriously.
have
thanks.
a doubt, I
Yeah,
just scroll. Hey, what
yeah.
did that video say? You
Thanks,
and
thanks.
that Vignesh
Yeah,
VG study.
yeah, 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 yeah. No,
There's
no,
so
he's
much to
good.
learn.
Yeah, yeah, he's good. Yeah.
I
So
started
what
it
about you?
just because I wanted. It's expensive, man. Applying for USMLE and like every single
Hmm,
thing you do here is expensive. Your letters, your rotations. I just wanted to give free resources because I had good seniors who helped me with a lot of free stuff, or I
nice,
spent a lot of time trying to find free resources and coming up with my own things. So just to make it a little easier for everyone.
nice. That's a nice thought. What about you, Weber?
Me, okay. Few reasons.
Hmm.
First reason was especially during the COVID time when I was sitting idle, doing nothing. Actually,
Hmm.
there's one guy who inspired me. There's a doctor in the UK turned entrepreneur now, Ali Abdal. You must have heard
Yeah,
about
Yes,
him.
everyone
yeah.
knows.
Well,
Yeah.
everybody knows
He's,
Ali
yeah.
Abdal. Yeah.
So he inspired me, and also
I
because of the
also have
fact
his
that
book somewhere lying here. Yeah.
um, and also because of the fact that I initially thought like I'm an extrovert, but maybe I was a bit shy. Just wanted to put myself out there, wanted to improve my skills and everything. That's one way. And the third thing is, I think opening an account on social media, I think you can impact thousands and millions of lives. Like, I mean,
Yeah.
sky's the limit. And with your thoughts, with your opinions, and the way you can make everyone's journey easier, I think that's very rewarding. I still have hundreds of messages in my DMs. I apologize to all my followers who have been like trying to get on, get to me, but I mean, I whenever I get time, I respond to them. But I feel very like satisfied when they text back and say, "Oh, thank you for the help," or "Thank you so much for creating this thing." You will know, Manish. You'll
Yeah.
have millions of messages lying around, and
Not
even you too,
millions.
Komal.
I'm very good at tackling those things. It takes a lot of my time. I don't have
Hmm.
any unread message on in my inbox, by the way. So
Oh, you're doing
somehow I
great then.
manage it. Yeah, but it takes a lot of time. I'm constantly on my phone. Screen time is very high and all those things. I have to
Hmm.
figure something else now, something out. So yeah, I mean,
No, it's
Somehow
good
I'm
to have
managing.
those messages, and sometimes, like,
Yeah,
one message can sometimes on a bad day feel very
yeah,
good.
yeah. Make your
It has
yeah,
happened to me. Like, I was
Yeah.
having a shitty day, and one of the followers sent me like a big ass message, and I was like, "Really, you think that? How sweet! Thank
Mm.
you."
nice. That
All right.
dopamine you get.
Yeah.
Okay,
That was a
okay,
nice
guys.
question.
Yeah, nice question. Thanks for joining in.